Can castor oil help treat varicose veins? Hi everyone, welcome back to this channel where medical topics are made easy. Now, before we start, please note that this video is not intended to replace your doctor's advice. It's meant to guide you through reliable resources so you can make informed decisions about your health. Also, please remember to like and subscribe as it helps me continue helping others. Okay, let's dive right in. What are varicose veins? Let's begin with a brief overview of what varicose veins are. You see, those twisted, bulging veins you might see in legs or feet are called varicose veins. They happen when the tiny valves inside the vein stop working properly. Normally, these valves open to allow blood to flow through, but then they close to prevent the blood from flowing backward. When they don't close properly, the blood pools up and the veins become swollen and twisted. This is what we call varicose veins. The Center for Disease Control and Prevention, CDC, explains that these veins lose their flexibility and ability to expand, causing them to twist and bulge. It's pretty common. In fact, according to the National Institute on Aging, about half of all adults develop varicose veins, especially women, people over 50, and those who stand for long periods. But here's the good news. In most cases, varicose veins are just a cosmetic concern. However, as the NIH points out, they can sometimes be painful or lead to complications like bleeding, swelling, skin changes or blood clots. Now, I'll put all my sources in the description box down below, so feel free to check them out. So what does the research say about castor oil? Given the prevalence of varicose veins and the desire for effective and accessible treatment options, you can imagine there's been quite a bit of interest in natural remedies like castor oil. So let's take a look at what the current research and expert opinions say about the effectiveness of castor oil. Before we dive into the details, I want to highlight a point that many experts make clear: there is currently no scientific evidence that castor oil can shrink or remove varicose veins. However, castor oil's main active component, called ricinoleic acid, does have some anti-inflammatory properties. And yes, there is some research that suggests it may help with skin conditions and wound healing. Now, as for the use of castor oil specifically for varicose veins, the evidence is limited and often contradictory. Some online reports and anecdotal accounts claim that castor oil can alleviate symptoms like pain and inflammation associated with varicose veins. Proponents suggest that the oil has moisturizing effects on the skin could help reduce the appearance of varicose veins, making them less noticeable. Others believe that castor oil's potential blood circulation boosting properties might help alleviate the symptoms. The idea is that improved circulation could potentially reduce the severity of varicose veins over time. However, it's essential to distinguish between anecdotal accounts and scientific proof. As much as we'd like natural solutions, there's just no solid evidence that castor oil can cure varicose veins. In fact, dermatologists and vein specialists stress that treating varicose veins effectively requires addressing the root cause of the problem, the faulty valves in the veins. Simply applying castor oil doesn't fix this underlying issue. What do experts say? Now that we've covered what the evidence says, let's hear what medical professionals have to say. Many experts agree that while castor oil massage might offer temporary relief from the discomfort of varicose veins, it won't solve the underlying problem. For instance, the Society for Vascular Surgery, SVS, cautions that castor oil is not a substitute for proper medical care. They state that applying castor oil topically is unlikely to address the root cause of varicose veins, which lies in the malfunctioning valves within the veins themselves. Similar sentiments are echoed by the esteemed Mayo Clinic. Their experts emphasize that while castor oil might help moisturize the skin and reduce inflammation around the affected area, it won't eliminate varicose veins. They also point out that more research is needed to fully understand its potential benefits and risks. That being said, Johns Hopkins Medicine offers a different perspective. Their article titled, "Can Castor Oil Help Treat Spider and Varicose Veins?" acknowledges that although castor oil has been traditionally used to soothe aching veins, there's no scientific proof of its effectiveness. Instead, they recommend seeking treatments like sclerotherapy or endovenous laser treatment, which directly target the faulty valves causing varicose veins. How to use castor oil safely? If your doctor approves the use of castor oil for your varicose veins, here's a safe approach as outlined by the Center for Vein Restoration. First, always do a patch test before applying any new substance to your skin. This will help you check for allergic reactions. Next, clean the skin over and around your veins. Then gently warm the oil slightly. This can help improve its absorption into the skin. Massage the affected area in circular motions for about 5 to 10 minutes. And if you like, you can cover the area with a soft cloth. Leave it on for a few hours if possible. But here's an important note: stop using castor oil immediately if you experience any irritation, redness, or discomfort. Alternatives supported by evidence. Now that we know that castor oil is not a cure for varicose veins, what else can you do? Well, luckily, there are alternatives backed by evidence that can help. Medical experts often recommend a combination of lifestyle changes and evidence-based treatments. Lifestyle changes include wearing compression stockings, elevating your legs regularly, and engaging in daily exercise such as walking. These measures can enhance blood circulation, reduce swelling, and alleviate symptoms associated with varicose veins. As for treatments, minimally invasive procedures such as sclerotherapy, laser ablation, and radiofrequency ablation are highly regarded. These methods are endorsed by organizations like the Society for Vascular Surgery as effective ways to shut off or remove problematic veins. Sclerotherapy involves injecting a solution into the vein, which closes the vein and redirects blood flow. Laser ablation and radiofrequency ablation use heat to shut off the veins. Both procedures are minimally invasive, meaning they have minimal downtime. Looking ahead. In conclusion, while castor oil might provide some temporary relief from the symptoms of varicose veins, it's not a cure. It is crucial to consult with your doctor to discuss the best course of action for your specific situation. They can guide you towards effective treatment options and lifestyle changes that will benefit you the most. Remember, your health is a priority, and making informed decisions based on reliable sources is key. If you found this video informative and helpful, please hit the like button and subscribe for more in-depth health explainers. Feel free to drop your questions in the comments section down below. I'm dedicated to helping you navigate the vast sea of medical information out there. Stay healthy, and I'll see you in the next video. Take care.